Good morning and welcome to the opening session of the 2020 annual meeting of the Maine Public Health Association. My name is Doug Michael. I'm a member of the MPHA Board of Directors and the Chief Community Health Officer with Northern Light Health, one of several proud sponsors of this annual meeting. On behalf of MPHA and Northern Light Health, we are especially grateful to all of you, our colleagues in public health, healthcare, and community service who come together, especially during this time of public health emergency, to learn from each other and to work better together as one Maine for one health. It is my honor this morning to introduce our keynote presenter, Dr. Nirav Shah. In June of 2019, just a little more than a year ago, Dr. Shah was appointed by Governor Janet Mills as the director of the Maine Center for Disease Control and Prevention. Dr. Shah received his medical and law degrees at the University of Chicago and studied economics at Oxford University. Earlier in his career, Dr. Shah served with the Ministry of Health in Cambodia, where his work involved investigating and managing disease outbreaks. And prior to coming to Maine, he served as director of the Illinois Department of Public Health. Dr. Shah, good morning, and thank you for being here with us to discuss public health priorities in Maine.
Well, thank you so much, everyone. Doug, I appreciate the warm welcome this morning, and to the entire team at the Maine Public Health Association, Becca Boulos and the entire team, as well as the board. I'm very thankful for the invitation to join everyone today to start us off along this year's series of conferences. What I'd like to do today is something of a revisitation of what we talked about last year at this meeting, which was public health very generally in Maine. And as many of you may recall, we did so through an interactive format. And I'd like to replicate that today, partly as an opportunity to hear from each and every one of you about where things stand with respect to public health, specifically around COVID-19 in Maine, but also to get a sense of where we've come from last year to this year. So what I'd like to do as I'm setting everything up is invite everybody to, if possible, take out your phones and open up your camera app and point your camera at that odd looking feature that's on your screen. And for many of you, but not for all of you, but for many of you, that will automatically prompt a website to be opened up. And then if that works for you, then just hold tight there and maybe hit the little heart button at the bottom of your phone screen, just so we know that it's generally working. While folks are getting spun up with that, let me say a couple of words about where I'd like to go today. I have been honored and privileged ever since June of 2019 to serve as the director of the Maine CDC. Some of you have heard me talk about my love, not just for public health, but of this position in particular. I had the privilege of serving as the director of the Illinois Department of Public Health for 4 years prior to this. And after my governor lost his reelection bid, and after his first term, my wife and I were talking, and she said, well, what do you want to do next? And I jokingly said, well, you know, what would be great is if I could just do the same job, but in another state. The reason that was a joke is that usually doesn't happen. Generally speaking, health directors are someone from the state, and it's very uncommon for someone to be tapped to go to another state. But fortunately, the way that the world works, sometimes in funny but fortuitous ways, it just so happened that the stars aligned and an opportunity to come to Maine presented itself. The reason I share that with everybody is that means that I happen to be in the very small percentage of people who was able and fortunate enough to have their dream job not once, but twice. Now, the reason for me that you go into governmental public health is times like the one that we are facing right now with respect to COVID-19. This is what the essence of governmental public health is about. A situation that is in many respects an existential one that requires coordination amongst all stakeholder groups public, private, governmental, and otherwise, where the stakes are incredibly high and we only have one shot to get it right. That to me is why I wanted to go into public health, particularly governmental public health in the first instance. Since that time, in June of 2019, all through now, we faced a number of challenges, but none so important or in some respects critical as what we're facing with COVID-19. Thanks to the wonderful support that people across Maine have shown our entire agency, Maine CDC has been able to serve as a leader, not just in the state, but across the country, with a lot of our efforts, be they be around expanded testing, around contact tracing, and around provision of social services to individuals who've been affected by COVID-19. But we're nowhere near being done, not even close. What I'd like to do today is to try to get a sense from everyone, a temperature check and a pulse check of where things stand today from each and every one of you, and then where we might need to go in the future with respect to our COVID-19 response. Many of you have been kind enough to listen to me talk about COVID-19 a couple of times a week since January. What I'd like to do today is to do less talking and to do a lot more listening from each and every one of you to help me get a sense of where we are and where we need to go. Now, many of you, 79 of you at least, have been able to log on to the presentation through this method. For those of you for whom that weird looking picture on the screen didn't work, here's the other way that you can log in. If you go on your phone's browser to menti.com, MENTI.com, and type in that 7-digit numerical code, that should also work for you. So what I'm going to do, starting on the next slide, is to think about where we are, particularly with respect to COVID-19. And some of these questions will be to try to get a sense of how we as a public health community are doing, but others are designed to help me at the Maine CDC get a sense of where we need to be going next. What are we doing well? But more importantly, what are we not aware of that we need to be made better aware of? To quote somebody famous, it's not what you don't know that gets you in trouble. It's what you think you know that just ain't true that does. And so what I'd like to get everyone's help today doing is getting a sense of what potential blind spots Maine CDC might have and what we need to be looking at and thinking about as we move through our phases of activation with our response, as well as as we are continuing to plan for the potential rollout of a COVID-19 vaccine, whenever that may be. We're going to do this for about 35 minutes or so, and then I'd like to take down the presentation and then get feedback and response from everybody about your reactions to some of the data that we've generated. So let's start, just to make sure we're all getting this. Question number 1, are you currently taking part in an interactive presentation? Let's see how much agreement we can get. Okay, good. Couple of folks are not quite sure. That's fair. That's fair. Okay. Got a lot of folks who are successfully able to log their answers. That's good. Okay. All right. I think for everyone, it's certainly working, and most of us are in agreement. So that's a good way to start off. In general, the structure of the questions today are going to be largely focused around COVID-19, but a certain fraction will try to get a sense of where we are with existing public health issues and challenges that we're facing. Indeed, one of the longer standing strategic questions on the horizon is how do we as an agency and as a public health community move forward with COVID-19 while simultaneously not losing sight of other significant public health challenges. For example, at last year's presentation, the three things that stood out to me was the need to renew and double down on our focus around obesity. We also generated data that showed very clearly the concerns that rural populations are facing. We've got to keep moving on those issues even while we're simultaneously grappling with COVID. But just to level set so we all have a sense of who we are as a group today, a few questions just for everybody virtually to get a sense of who your colleagues and co-attendees are. So let's start. What county are you from? And we'll give everyone a couple seconds for these data to come in. And while everyone is filling that out, one of the things that I'm going to try to do after we're done with this is first and foremost, I will send to the MPHA team a PDF of the slides from today with the results. So everyone can get a sense of what kind of data we generated for you to look at later. The other thing I'm going to try to do is do a quick comparison on some of these questions against last year's, just to see where we've made progress and where we haven't. And then the final note for everybody today is that these data are completely categorically 100% anonymous. I do not have a way, nor would I have a way to re-identify any one person's answers. So please know that I would like you to answer truthfully and with complete anonymity in the process. Okay, so I think similar to last year, the bulk of our attendees are from the most populous parts of the state, but others from a smattering elsewhere across the state as well. Similarly, as last year, what type of organization do you associate yourself with working for? Again, when I send these around, I will probably send around last year's slides as well, which we thankfully still have, and so that way everyone can again get a comparison of how our public health system has evolved and changed in the last year. Okay, so a generally well-divided group, but more representation from community-based organizations, governmental partners, individuals who work in hospitals, and then smaller representation from colleges and universities and clinics. If we were in a live audience, it would be interesting to see who is comprised in the other category. Given the challenges of virtual, maybe when we break and get a little bit of Q&A, we can get a better sense of who our colleagues in the other category there are. I'm curious to get everyone's take on where you focus within public health. Now, I fully recognize that that is hardly an exhaustive list. And I almost by design didn't put an other category in there. If you don't find something that directly matches exactly what you do, my ask is that you go with what you think most closely matches where you are. Okay, so the bulk of those of us who are joining us today are roughly about half are either in chronic disease and health promotion or in substance use, with a smaller smattering of folks who work in the research fields as well as in public health or healthcare administration as well. So, that gives us a sense of who we are right now today, at least as those who have joined us. Curious to get a sense of workforce, which is a topic we touched on last year. And again, I'm eager to hear how things have evolved since then. So immediately what starts to jump out is, again, at least among those who have joined us today, a large fraction of individuals who are newer to public health. That's a welcome sign. Certainly one of the challenges across the country is where we go with respect to public health workforce development. And I'm delighted to see and then eager to compare this number and these data against last year's data as well, which is to say the majority of folks, well, not the majority, but the highest category of individual respondents today are among individuals who have been in public health for fewer than 5 years. That's a good sign. But where do we go in the future, particularly those who have been in the field for longer? What can we expect with around retirements in the upcoming few years? Certainly one of the concerns that is omnipresent in any organization, certainly within Maine CDC, is how we think about planning on a long-term scale while simultaneously recognizing that many of our staff, folks who are sometimes have the highest degree of institutional knowledge, may be retiring soon. And what we're seeing is that of those who have responded now, about 80% of folks, the group where we see the most likelihood of retiring, thankfully, is 6 years out. And those who are likely to retire in the next year, thankfully, the least likely. So that gives us some sense of stability within the public health workforce. And again, I'll be interested to see how this compares against last year's data too. One of the things I mentioned at the top that I want to get a sense of today is the temperature and the pulse of how we as a public health community are feeling right now. I asked this exact same slide, exact same question last year. Haven't changed a single word in it. And again, I will be interested to see how what we generate today compares against last year in terms of whether the work we do is addressing pressing issues, whether we get fulfillment from it, and whether it helps improve lives. It also gives us a sense of where, thinking about workforce, we may need to focus a bit more. Now, I'm delighted to see just in the 60% of folks who have responded that overall, the answers are trending on the higher side of agree. We're not seeing any 1.1 or 1.3 level type answers. For the most part, folks are, they believe that the work they're doing is addressing important issues. It certainly is helping improve lives, but if we need to focus anywhere, it's around fulfillment of around the work that we do. That again, it is an important piece of data and will be interesting to see how it compares against 1 year ago today. So I'd like to shift gears now and zero in a bit more on COVID-19, again, in an effort to get everyone's temperature, to do a pulse check of how the public health community in Maine is faring in the face of COVID-19. We're going to touch on a number of issues, not all of them, but I'd like to, again, try to get a holistic view of how things are going with our response as a community thus far, where we need to go in the future, and then what specific concrete advice you've got for Maine CDC. Let's start. What is the one word that you would use to describe COVID-19 in Maine? One word. Very, very interesting. You know, for me, the interesting part about word clouds is my my pre-test hypothesis and then my post-test reaction. Because as I was writing these slides up, I would not have the word that has emerged and around which folks have coalesced is this word controlled. And given the recent experiences that we've had in Maine with respect to significant outbreaks linked to things like weddings that generated transmission up and down the state, it's interesting to see that controlled is a descriptor. Challenging, there's no question about that. Frustrating, stressful. Each of these words could be used to typify 2020 as much as they could COVID-19. But I am interested in as we break in a couple of minutes, I'm interested to get everyone's sense of whether what your peers have generated matches with what you would have hypothesized they would. But certainly controlled, as everyone has heard, and I would be remiss if I didn't mention that, that could change. We have gone through just in the past few weeks instances where our daily case counts, our transmission rates and hospitalizations, we're looking more like mid-July than they were mid-September. So where we are right now is something that could absolutely change. We at the CDC are going to continue to need everyone's cooperation, partnership, and assistance if we're going to keep a lid on things. So I'm curious to get everyone's sense of societally across the state, how seriously you feel COVID-19 is being taken, both within the public health system, within people around you, your peer group, and then more generally across the state of Maine. And as the data are coming in, I ask everyone to try to get a sense of what you would have predicted your peers would have registered here. Candidly, I think this on my end lines up with what I would have hypothesized. I am, of course, delighted to see that we as a public health system believe, a public health entity, we collectively believe that we have taken this seriously and simultaneously risen to the challenge. That warms me to see that. And then I think what we're seeing in the other two is that we tend to believe that those around us, we tend to sense that those in our immediate circles are the ones who are the most engaged, but we still have concerns about whether statewide folks are taking COVID-19 seriously enough. This lines up with what I would have hypothesized. Be curious as we transition over to discussion whether this is what you would have hypothesized as well. One of the questions that my colleagues and I have been discussing at the national level is how public perceptions of public health have changed as a result of and in connection with COVID-19. Are folks across the country, but specifically here in Maine, are they more familiar with what public health does? Are they more satisfied with their public health system? And then, of course, are they more apt to fund it in a robust manner going forward? The first two questions come from, I think, perhaps something I may have shared last year, which is many, and if not, many years ago, about 6, 7 years ago, a statistician, a public health survey expert at the Harvard School named Dr. Bob Blendon did an interesting survey where he asked individuals across the country whether they know what their public, in this case, the state public health system, the state public health department, whether they're familiar with what the state public health department does. And most people said no, they're not familiar with what their state public health department does. Professor Blendon then asked a follow-up question, which is, are you satisfied with the job that your state public health department does? And most people said, no, we're not satisfied with it at all. So the takeaway there is that, at least at the time of the survey, most people across the country don't know what their public health department does, and they don't think they're doing a good job at it. One wonders whether COVID-19 has changed some of that, whether there's more familiarity with the bread and butter tools of, say, infectious disease epidemiology around testing, screening, contact tracing, isolation protocols, and whether there is more satisfaction as a result of that. I'm seeing here that the group is perhaps a little bit more skeptical than I am. That is to say, there may be more familiarity with, but not a lot of agreement on whether there's greater satisfaction, let alone a greater likelihood or propensity to fund public health activities. This is clearly something that we as a community need to focus on, heightening familiarity, generating at least a better sense of satisfaction, if that's warranted, and then using that as a national level to generate more funding. I'm curious, just kind of, I wasn't sure whether to put this slide here or in the workforce section, but I'm just curious from each of you, how has it been for you working in public health during this time of COVID? Even if you're not working on infectious disease matters, as everyone is aware now, COVID has affected literally every part of the healthcare and public health infrastructure. So even if you're not directly working on COVID, you're still working on COVID. So what immediately pops out is there seems to be some degree of parity between working in public health during this time being as frustrating as it is rewarding. Those with more and detailed understanding of human psychology could probably help us understand what's at play there. But I think it goes back to an earlier slide around a recognition that perhaps now more than ever, the work that public health does is more essential and more important to the lives of everyone in the state than it ever has been. And clearly, it's not the status quo anymore. I want to shift gears now and think and talk a little bit about vaccinations. There is so much coming in the way of vaccinations. What I'd like everyone to do here is rank order where you are the most concerned about issues around vaccination. This slide's a little clunky, so it might take a little while to get all the data in, but let me know about what ranks in your mind as the first, second, third, fourth, fifth, sixth concerns. I fully recognize that this slide could have had 7th, 8th, 9th, 10th, so on and so forth. But to just start us off, these were the ones that my team and I felt were perhaps the most top of mind. Let me say a couple of words about vaccines while the data on this slide are coming in. None of us knows when a vaccine will be made available in large and sufficient quantities. There are varying projections out there, but one of the things I think we can take away from them, based on where we are right now, is that vaccines may be available in the coming months, but for very small targeted groups of individuals. They will not be likely available for larger population health distribution until sometime midway into 2021. Dr. Redfield last week suggested the second quarter or perhaps even the third quarter of 2021. None of us is sure when a vaccine may come out. And there are, of course, issues, concerns that I'm interested in hearing from you on about what is keeping you up at night right now around vaccines. When I say safety in number 2, what I'm really hinting at is concerns that any eventually approved vaccine may not have sufficiently robust safety and, by implication, efficacy data to support its widespread use. Equity remains a concern. There is much more work to be done just in the state of Maine around ensuring equity around issues of COVID-19. Those are going to loom large in vaccine work. We're already trying to do a better job as part of our vaccine planning to take health equity greater in mind. All right, well, most of the data are in, and hesitancy and safety seem to be the leading two concerns, health equity being a very, very close third. I'm curious, and sorry, this slide, I didn't put the word vaccine in it, but specific to COVID-19 vaccine planning and preparation, what is the one thing that Maine really needs to focus on? And again, specific here just for vaccines, I ran out of space on the title, but as it relates to vaccine planning and preparation, what do we really, really need to zero in on and focus? Or to ask the question in a manner that I sort of share with my team, what's the one thing that if we don't get right, the entire apparatus around vaccine planning could fall apart? I think this will scroll automatically. Yes, it should scroll automatically. Let me see if I can, so education, outreach, education, gaining trust, health equity. Okay, very helpful. One of the concerns that is top of mind as we think about planning And there are two questions here, just to queue them up for everybody, so everyone has a preview. I'm interested in two things right now. On this slide, I'm interested in knowing in general who you believe is the population at the highest risk for COVID-19 in general. The next slide, I will ask you to think about that as it relates to vaccine prioritization. So again, right now, I'm just generally interested in who you feel we need to be doing a better job around, or the population that is the highest risk right now in Maine. I recognize fully that there is a lot of overlap among these groups. They are not mutually exclusive categories. And if we could create Venn diagrams, perhaps it would be elderly, racial, ethnic minorities, or frontline workers in rural communities. I fully recognize that, but assuming that you can sort of keep them separated in your minds, this is what I'm trying to suss out right now, which is who's the population that gives you the highest risk, highest concern right now? This is very interesting, very, very interesting. And to be sure, is largely the you know, we don't have priority groups at all, but the data suggests that this is you know, essentially how the risk stratifications largely break down. Rural communities, again, fully recognize that rural communities are not a homogeneous group, but rather a designation. But for the purposes of trying to get a sense of the public health community's risk ordering, this is very helpful. Now, I'd like to ask you the same question, but now with a more specific focus on prioritizing the rollout of a COVID-19 vaccine. As you're going through this, on day one, whenever a vaccine is approved or authorized and rolled out to states, on day one, day two, month one, month two, there will not be enough vaccine anywhere in the country to satisfy the demand for every single person who would like to have it that day. And thus, at a national level, there will be some degree of prioritization. There are different groups across the country that have been meeting. The most notable is one associated with the National Academy of Science that has started to analyze the extent to which and how any COVID vaccine could be prioritized. They've published some of their preliminary draft findings. And a question on the table is to what extent those national level analyses apply in accord with what we in the public health community across Maine think is the right prioritization. And so I'm curious here to get a sense of where folks think we in Maine, how we should be thinking about prioritization. And we're only about a third of the way through the answers. Well, actually, I'm not going to say anything. I don't want to color the remainder of folks who are working their way through that kind of busy section on your phone. All right, so we've got about 2/3 of folks who have logged their responses. And very interestingly, just based on the data that we at the Maine Public Health Association meeting today on September 29th have generated, this accords almost exactly with one or two notable changes, it accords almost exactly with what the National Academy of Sciences has proposed for their rollout of prioritization for an eventual possible COVID-19 vaccine. They placed a little bit higher primacy on critical industry workers, which admittedly I did not define very well. So I suspect that it's fallen in the rankings just because it's a nebulous category on this slide. But this is a quite shockingly identical or similar, I should say, to what the National Academies has put out in their draft. Very, very interesting. I want to get a little bit now, I want to get some specific feedback around Maine CDC. We've tried to, and I want to start in a seemingly odd place, which is around our website. We're always trying to make our website better. And many of you who are joining us today are our prime users, prime constituents for our website. I'd like to know how we're doing on it. Okay. So I think we've got more work to do on our website, particularly around making it user friendly. I concur with that. I myself consult our website a lot, and I find that it's just one long flowing website, and it's difficult to zero in on finding what I'm looking for. So that's very helpful feedback and something that we can do better on. So as we wrap up here, I'm curious, what is the one thing from those of you who are on the ground working on the COVID-19 response, what is the one thing that you've observed that Maine CDC really needs to know about that you don't think we get right now? What's that one thing where you think, you know, if they would only understand this really critical thing, then maybe things would start heading in a better direction? I want to give folks time to weigh in here. And I'll kind of scroll through these as results come in. So a very clear theme around the need for a more robust and thus coordinated public health system and the importance of infrastructure there. And then a lot of concerns and feedback around what folks are out there on the ground realizing as they talk to folks. Skepticism around COVID-19, things of that nature. One person wrote, people do not understand the risk and how it affects the entire community. That sums it up. That's something that I myself have been very concerned about. Okay, very helpful, very, very helpful. Trust, yep. A shout out, our DL is doing a great job. Love to see that. Okay, very, very helpful. So then the last question here before we break is, or before I take the slides down, is of course, we have to start planning for a world in which COVID-19 is not the only thing we're talking about. And what I wanted to zero in on today is something that I know that Becca and James on our team have talked about, which is how do we think about policy development, working together on issues after and even during COVID-19? What is the best advice that you can share with me and my team about how we should think about policy development going forward? And I'm eager to get responses, both very tactically, for example, how do you do policy discussions on Zoom, as well as substantively? What do we really need to focus on in addition to COVID-19? Candidly, COVID-19 is going to be with us in different forms for the foreseeable future, whether it's vaccine rollout, whether it's post-vaccination monitoring, whether it's dealing with the after effects, because it will continue to simmer. COVID's going to be with us, but we simultaneously need to plan for other areas of policy development. And I'm curious to get everyone's take on what that needs to be like. I'll give this one a minute. So a lot of themes emerging around the need for better coordination around where we go from here with respect to incorporating COVID in ongoing work, for example, around obesity, as well as independent of COVID, concerns around infrastructure, capacity, things of that nature, rebuilding local infrastructure. Okay. All right. And then finally, oh, the voting is closed. And that's weird. Okay, let me, well, my screen is saying that this is, okay, I think, and this is a slide I ended with last year. So I'd like to do the same this year, which is to get everyone's take about whether we are going in the right direction or the wrong direction. Well, this is encouraging, which is to say that even though there may be concerns and the need to continue building out capacity, um, the vast majority of folks, at least those who have joined today, at least believe that we are generally going in the right direction. That doesn't mean that we can stop the work that we're doing by any stretch, but it does suggest that we are headed in the right direction. So I'd like to, Frederick, if I could ask you to take down the screen sharing, if I could, and Becca, I'm going to turn it over to either you or Doug. I think Becca indicated that there are at least 2 questions, and so Becca, I'd love to start there.
Okay, great, thank you. And thanks everyone for your participation in this platform. It's our first time doing this, and this has been great to see. And thank you, Director Shah, for taking time this morning to talk with us. The first question is, we are seeing outbreaks where groups of teachers have been exposed. What precautions should schools be taking, and what are the guidelines around teachers meeting and gathering in person?
Sure. So in terms of precautions, there are at least 6 precautions that every school that is contemplating any degree of in-person education, there are at least 6 that they're required to maintain and abide by. This includes things around physical distancing, the use of barriers to reduce transmission, things of that sort. But separate and apart from that, anybody, whether they be a teacher or a healthcare worker or anyone of any extraction, should, when they're not in the workplace, be doing things that are smart right now. Particularly if you know your job puts you in a setting where you could be exposing others. So if you're a teacher, if you're a healthcare worker, for you, the importance of setting a good example around things like mask wearing and maintaining physical distance is more important now than it ever has been. So there aren't exact guidelines. Schools may have them at the individual level, but what we recommend is that for those who are working in situations of that nature, they take special precautions to keep themselves safe from potentially exposing COVID-19 to, say, the students in their classroom. Now is the best time to be practicing those things as we are getting ramped up in the school year. Setting that example right now will help it have durability throughout the school year.
Great, thank you. And the next question is, thank you for your leadership, Director Shah. What are your thoughts on creating more local levels of public health embedded within our rural communities, aligned with the public health districts that address our population needs?
Mm-hmm. That's something that's been on our minds, and when we've talked about, admittedly, some of the discussion around that, particularly via the local public health and statewide public health assessments that were slated to be ongoing this year, admittedly, some of that has been put on hold because of the need, for example, for district liaisons to be very intimately involved in the COVID-19 response. So for me, that question, as with many policy questions, turns on what the data tell us and what the needs are, and then in what fashion we could structure something to be responsive to those needs. Candidly, I don't think until we really have the data from those health level system assessments will we be really able to get a sense of whether that's the right strategy or whether the more classically centralized strategy that we've had in recent years is the way to continue. I don't want to put my thumb on the scale. I'd really like to see what the results of those system level assessments are to really get a sense of what the needs are and then how we could fill them.
Great, thank you. Mm-hmm. I'm not seeing any more questions in the, oh, that's a lie. Do you have time for 1 or 2 more questions? I know you have a hard stop at 10.
I do, I certainly do have time.
Okay, all right, thank you. So the next question is, thank you for all you have done as a Maine leader, Director Shah. How can we be assured when a vaccine rolls out that it is safe and not rushed for political reasons? And how can we assure others, reassure others? Sorry.
Sure. So, that is certainly a concern that's been raised in different quarters. And it's a concern that I think we should all pay heed to. That being said, there are in the vaccine development process safeguards that would either reduce greatly the risk of a vaccine being rushed out, or alternately, if that were to happen, make it very clear and transparent that that is what has happened. So there are independent data safety monitoring boards that have to sign off before a vaccine trial has been ended, that the vaccine is ready for the next stages of approval. These are individuals with no affiliation with the corporations that are running the vaccines or with the regulators that would approve them. There are similarly independent advisory committees, one of which I sit on, the Advisory Committee on Immunization Practices, as well as one out of the FDA, the VRBAC, and then the one that I mentioned, the National Academies of Science panel, that are all comprised of individuals that have no affiliation with vaccine manufacturers or the ultimate regulatory decisions, that sign off on what they see in the data. So there are a number of checks that are in place, but those checks are sufficiently transparent such that if there were an end run around all of those, and there's no indication that that is in the works right now at all, we would have awareness that such a thing were happening. So is this a risk? It certainly is. We always have to be concerned about the safety as well as, of course, the efficacy of anything that might be contemplated to be administered to 330 million people, to say nothing of billions of people around the globe. That has to be a concern that we raise and discuss. However, we should do so recognizing what the safeguards and structural checks are that are already in place that would have to be circumvented for something of that sort to happen, and then what we would do in response to that. The risk, I think, that is talked about is whether something of this nature could happen under the cover of darkness. Again, that's a risk that we should talk about, but it's less likely to be one that happens without anybody knowing about it.
Great, thank you. The next question is, what are your thoughts on shoring up public health capacity and infrastructure as they relate to COVID-19 and public health in general as we move forward?
Mm-hmm. Well, I think COVID-19 has provided an opportunity, as we talked about in the slides, and the data suggests from what all of you shared, that there is an opportunity here. But on top of that, the opportunity is such that most folks, and I think more folks as compared to last year now, have a better sense of what public health does in Maine. Whether that means that there will be an opportunity to generate more funding for it, that's the open question. I think that's where we've got to go, though. As a public health community, and I'm speaking nationally now, if we can't use COVID-19 to illustrate the value of having a robust public health system, we haven't done our job at the national level.
Thank you. Do you think you have time for more questions? It's 10.
I unfortunately do have to hop off for our scheduled incident command briefing, but Becca and the entire board of MPHA, as well as everyone who's joined today, I want to take a second to thank you for letting me share with you kind of where things are, and then more importantly, providing your feedback up to me as we're going through our process. I'm very appreciative for that opportunity.
We're so grateful to have had you here today. We know how busy you are, and we're just so thankful. So thanks for taking the time to present to us, and have a good rest of your day.
Thank you, everyone.
Take care. And then just so folks know that the questions that you asked in the chat, they are saved, and I'll do my best to follow up with Director Shah and see if we can get some answers to those. And we are very grateful to you for taking the time out of your morning to be here. I don't know, Doug, if you have any last remarks you'd like to make before we end this session.
No, no, thank you very much, Becca and Heather and everybody for joining us today.
Great. We hope to see you back here at 10:10 for our emergency preparedness session. Thank you.